Well, good evening, ladies and gentlemen, or afternoon, I should say, and welcome to the 2016 ColoHealth Healthcare Reform Webinar. My name is Justin Brogdon, and I'm the sales manager here at ColoHealth. I'm going to take 20 or so minutes and briefly review the ins and outs of the new processes associated with healthcare reform. Please list any questions that you have in the chat box, and I will be sure to cover all of them at the conclusion of the webinar. As I'm sure you're all aware, there have been some major changes in health insurance over the last few years. Some of you on the line, I'm sure, might be losing your grandmother plans or grandfather plans, while others might feel a little lost navigating this whole new convoluted process. The goal is really to help you protect yourselves against expensive mistakes and certainly avoid the hurdles that many have faced with this new system in Colorado. For 2016, open enrollment will begin on Sunday, November 1st, and it's going to run through January 31st. And there's a few important dates I want to point out. You need to remember that if you want your coverage to go into effect the first of the next month, you need to submit it by the 15th, as you can see. So as we're going in now, you'll have until the 15th of December to submit your applications, your enrollments for a January 1 effective date. If you were to submit that application on the 16th of December, it's going to cause your plan to start on the 1st of February, so the following month. If you miss that 15th cutoff, your plan, the earliest it can become effective will be at the 1st of the following month. Another important date to note is that your first month's premium must be paid by the 25th of the month for your coverage to become effective on the 1st of the month. Now, I want to talk about that for just a second when we're talking about these dates, because it's really important. I can't tell you how often it happens through the course of these open enrollments that you see people on the 15th struggling to get that plan submitted, and things are really chaotic on the deadline date. So I encourage everyone on this line to be proactive and work with your personal benefits consultant here at ColoHealth to make sure that you're all set and not creeping up on that deadline on the 15th. And certainly, as soon as you get your enrollment submitted, I would encourage everybody to make that first payment as promptly as you can. You do have until the 25th of the month to make that first payment. But one thing to consider is that the insurance company is not going to issue your policy until that first payment is made. And to ensure that you get your policy and your ID cards in hand prior to that coverage starting, it's going to behoove you to definitely be proactive about making that first payment and not wait to the 25th. If you submit your payment on the 25th, you're likely not going to have your policy and ID cards in hand until, halfway through January or even further than that. And if you have to use that coverage, you certainly will still be covered, but it'll be a lot more hassle on you than you'll want to deal with. So for 2016, we've got some great things going on with these plans and some things that are not so great for a lot of us. Looking at the pros with all these new Affordable Care Act plans, I guess the biggest one that's hard to overlook is the fact that everyone can get coverage now. In years past, we've had a lot of clients who maybe they had type 2 diabetes, or maybe they had a heart attack in the past and they were unable to get coverage. And now with the new Affordable Care Act, everyone can get covered. There's no pre-existing conditions that can weigh in on what your cost is, and really is affording more coverage to people than ever before. The cons, looking at this slide here, would be obviously if you've done any looking around, you've noticed that the cost is considerably higher than it's been in the past. The doctor networks have gotten much smaller. Most of them are HMO networks, where they were PPO networks in the past, and where PPO networks are available now, which give you a lot more flexibility in terms of how you receive your care, they come at a pretty hefty cost. So Definitely some pluses and some minuses there. Where do we start with all of this? The first thing really I think we want to understand about the whole Affordable Care Act and understand when we're searching for a plan is that the plans are separated into different metallic tiers based on their cost and the benefit levels ranging from bronze to platinum. So let's start with our bronze plans. They're going to be the plans that are going to offer you a lower monthly cost. They're going to have a higher out-of-pocket liability and fewer benefits. If you're someone who takes some ongoing medications that might be really costly, bronze plan may not be for you. You're not going to get really great prescription coverage with bronze plans prior to meeting that deductible. The silver plans, this is typically going to be your very best value of cost versus benefit, and is going to be if you're eligible to take advantage of the cost-sharing assistance, and we're going to talk about that in just a little bit, you will have to have a silver level plan to take advantage of that. The silver level plans are the most bang for the buck, probably the most popular plans we sell in Colorado. The next would be the gold level plans. Now, these are expensive monthly, but they will have a lower overall exposure and are a great option for any of you who have major health care or prescription needs. If you're currently being treated for something and you know you're going to meet your deductible, really getting a gold level plan might be your best bet because it's going to give you the most comprehensive prescription benefits and doctor visit benefits, as well as having a lower overall out-of-pocket. And lastly, you see the platinum plans, the Cadillacs, as I like to call them. These are going to be your most expensive plans in the market. Many of them do not even have deductibles associated with them, so it's coverage from the first dollar that you incur on a claim. For any of you guys who are coming off of corporate benefits, you're probably used to a very similar plan as these platinum plans. If you can, if it makes sense with the cost of them where they're positioned, it might be a perfect fit for you. Now, there is a fifth plan option that's not included here in this slide, and that would be our catastrophic plans, which these plans are available to the under 30 crowd. And for any of you out there who might have a hardship exemption, and really the hardship exemption would just be you showing proof that the plans that are available to you are just unrealistic and unaffordable. So with the catastrophic plans, the coverage is going to be similar to many of the bronze level plans, but they will also include 3 doctor visits at a copay. So in addition to folks who have hardship exemptions, these plans really were designed for students. So what we ran into is I'm being told that there's no audio here. Can you guys hear me? If you can hear me, please type in the chat box that you can. Okay. If you're having a hard time hearing me, it may be that you, if you're trying to listen to this straight through your computer, that may be an issue. I would suggest maybe trying to call in and using the meeting ID to get in if you can't hear. We are recording this, so we will have it available if you are unable to hear us. All right, well, I'm going to get back to it. So another thing to consider is for a plan to be ACA compliant, it must include coverage for certain preventive health benefits. You're going to see as you're shopping around that these are listed as EHBs, or the 10 essential health benefits. And as you can see, these include ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse treatment, prescription coverage, rehabilitative and habilitative services and devices, lab services, preventive and wellness services, and chronic disease management, and lastly, pediatric services. So that's something you're going to see these. You're going to see things like your EHB deductible and EHB referenced a lot when you're shopping for plans. So just be aware that that's what they're referring to. Now let's discuss the plans. There's a few distinct plan types within these metallic tiers. And the first one we have is going to be your traditional copay plans. The great thing about the copay plans is that you know what you're getting for the money up front. You know, if you're going to go to the doctor or fill a prescription, you're going to have set amounts that you pay for those services. A lot of people who are coming off of group plans find these plans to be what they're used to and really what works for them. Another great thing about them, they have a very wide range of deductible options. They're ideal for people who have some maintenance health needs. You know, if you're somebody who goes to the doctor often, or you are someone who takes a maintenance prescription for something, especially ones that are costly, could certainly be a great option for you. You know what to expect when going to see the doctor and filling a prescription. That really is the best thing about the plan. Your preventive care is also covered 100%, not subject to your deductible or any out-of-pocket maximum as well. Also, another plan, some of the more for you who are proactive about your health and really more cost-conscious would be our high-deductible health plans and our HSA-qualified high-deductible health plans. With these plans, a lot of people consider them to be old-fashioned insurance. There's a story that was told to me when I first got into business kind of explaining the value of an HSA-qualified plan, and it was the analogy that you would never expect your car insurance provider to pay for your oil changes or to help you get a new set of tires on your car or go wash your car. You know, those are things that you as an owner take responsibility for, and you take care of it. The auto insurance is going to cover you in the event that you're in an accident or something catastrophic happens. And that's really how health insurance was originally designed, and that's what these plans are. So they're perfect for those who are looking for a bare-bones catastrophic plan. You're going to find that they have considerably lower premiums. You have the ability to control your out-of-pocket costs. They're going to have higher deductibles. And in most cases, you're going to pay everything until your deductible's met, and then you'll be covered. There are a few that do offer some copays, but they're pretty rare these days. If you also get one that's HSA qualified, it's going to give you the ability to use pre-tax dollars to pay for all of your out-of-pocket medical expenses, and that can certainly save you a lot of money too. Just like with the copay plans, your preventive care is covered 100%, not subject to your deductible or your out-of-pocket max. And, you know, if you go with the HSA route and you are someone who is exploring trying to get some assistance in terms of a subsidy, it's a fantastic way of lowering your taxable income and potentially increasing your subsidy eligibility. So that's something to consider as well. So how are your premiums calculated? Well, one of the biggest changes that we've seen is really in how the premiums are calculated. So as of January 1st, 2014, the rates can no longer be based on any type of risk and only can vary based on age, residency, and tobacco use. So, again, you can't be denied coverage. You can't have coverage excluded for any specific condition, nor can you be charged a higher premium due to past or current health issues. So, in that way, they're a lot more straightforward. There is no underwriting associated with the policies now, like for many of you who got coverage in the past with us. I'm sure you remember all too well having to try to remember how many times you went to the doctor in 1992 and what that podiatrist name was that you went and saw. You know, there's no more of that, really. It takes 10 or 15 minutes to submit an application these days. Now, as most of you have seen, the changes have allowed a lot of Americans the ability to get coverage that had to go without in the past due to pre-existing conditions. To no one's surprise, that has had an adverse effect on the cost of carrying health insurance. And one way to combat that is looking at exploring your subsidy eligibility and your cost-sharing assistance eligibility. So subsidy eligibility is really the technical term for it is advanced premium tax credits. So what that means, let's talk just for a minute about the advanced premium tax credit. So anyone who falls within 400% of the federal poverty level, and in Colorado 138% of the federal poverty level, is eligible for an advanced premium tax credit potentially. That is about $46,000 for an individual, and for a family of four, right around $94,000. That's a sliding scale. The way that the subsidies work is however much you are eligible for, the government is going to send that much on your behalf to the carrier that you choose to enroll in, and you are going to be responsible for paying the difference of that. And for anyone who falls at 250% or below of the federal poverty level, which as you can see is right around $30,000 for an individual and $60,000 for a family of four, they're also eligible for an additional assistance in addition to the premium assistance of cost-sharing assistance. So when we're talking about advanced premium tax credit, that has all to do with the monthly cost and expense of carrying health insurance. So a great way to think about it is the subsidy has to do with what you pay every month. The cost-sharing assistance deals with your liability within the plan. It's on a sliding scale based on where you fall within that federal poverty level, but it is going to reduce your deductibles. It's going to reduce potentially your out-of-pocket maximums, the amount that you pay for your copays, all of the liability and the ways that mechanics of how you use your coverage. So for people who really can take great advantage of it, who are getting the most assistance, it could be the difference between having your maximum out-of-pocket on a plan be $6,850 and it being $750. So if you'll want to work with somebody who really knows the way around the system, and I encourage everybody to reach out to your advisor here at ColoHealth and get them to help you check your eligibility. But we want to make sure that you're able to take advantage of all the assistance that you're eligible for. So now it is time to make a decision. If you have current coverage, should you keep it? Can you keep it? Your existing coverage is going to fall into one of three categories. So the first category is going to be our grandfather plans, and these are policies that were effective March 23rd of 2010 or earlier. So all of those plans are grandfathered, and you should be able to keep those for as long as the insurance company keeps offering these plans. 9 times out of 10, if you're eligible to keep a grandfather plan, you're going to be in the best shape to keep that plan in place. These plans are not subject to all the reform mandates. They do have lower premiums most often. I do know I've been hearing from some of my clients who've been getting some pretty substantial rate increases on their grandfather plans. But they also do meet the minimum essential coverage requirement, so there's no tax penalties associated with them. The next would be our non-grandfathered or grandmother plans, and for everyone in Colorado that has one of those plans, they will be losing those plans this year, so we'll need to help you guys get a new ACA-compliant plan in place. These plans are any plan purchased between March 24th of 2010 and October 1st of 2013. I won't go too much into the benefits of them because we know for certain in Colorado that you will be losing them, and I'm sure you've heard from your insurance companies already about that. And lastly, our ACA-compliant plans purchased on or off exchange. And in Colorado, the last I heard with Connect for Health Colorado is that you would need to actively go on and make a decision about whether you wanted to renew your policy or to get a new plan in place, that it will not auto-renew this year. So take those things into consideration. If you're eligible to keep a grandfather plan in place, unless you have a rider on that policy for a pre-existing condition that you had that's currently not covered under that plan, and you want to get coverage that's going to cover you for that, or unless you're eligible for a pretty substantial subsidy, my experience has been that you're going to be getting a lot more bang for the buck by keeping that policy in place. The provider networks associated with these grandfather plans are a lot more robust and flexible than the policies that you're going to find available in the marketplace today. But it is something, there certainly are scenarios and situations where I find that my clients, it would make sense for them to get a new plan in place and take advantage of a subsidy and get coverage for things that they've been paying for out of pocket in the past. It really just depends on your particular situation. That's why it's important to work with one of our experts here at ColoHealth that can really help you drill down and figure out what your needs are. So I always like to put this in here when we're talking about the Affordable Care Act. We talk to a lot of folks out there in Colorado, and there are some mixed reviews about Obamacare and the Affordable Care Act. I just want to make sure everybody understands what the penalties are if you do choose not to participate in the Affordable Care Act. It's gone up from this past year, as you can see. For 2016, there's a $695 individual penalty and a $2,085 family penalty, and that is the bare minimum. It's that versus 2.5% of your adjusted household income. So consider that really when you're thinking about foregoing the Affordable Care Act. I've had clients that were just completely morally opposed to it, and I certainly understand in a scenario like that, and I really don't weigh in one way or the other. I just want to make sure that everybody has the facts. So for those of you who have kids and are considering doing that, it's half the individual amount for kids under 18 or 18 or under. And another thing to consider, as I mentioned earlier, is that you might qualify for an exemption, for a hardship exemption, if you can show that the plans are just clearly not affordable to you. And there are some other exceptions to avoid the penalties you'll see here in the diagram. But that is the healthcare reform in a nutshell. You know, I want to kind of touch on the things that you need to, that I think are most important and you want to focus on moving forward during open enrollment. I would first encourage everyone on the line to be proactive. Issues tend to arise when waiting until the last minute. Expect delays in processing, especially on exchange. One important thing to note about when you submit an enrollment on exchange, it's going to go to the exchange, and then the exchange is going to send that enrollment over to the respective insurance carrier that you enroll with, and that can take 4 to 5 days sometimes. So that's why I say you cannot be proactive enough when getting your health insurance in place, especially with Colorado. We're being promised many updates and improvements with the Connect for Health Colorado enrollment process this year, and we will know more about that on Monday, but my fingers are crossed. I'm optimistic, but be proactive, people. It is definitely in your best interest to get on top of this and get it behind you. And as always, I recommend that everybody on this line, I'm assuming that if you found your way to this webinar, that you are communicating with one of our expert advisors here at ColoHealth. Allow them to save you headache and frustration. Really, I can't say enough how important it is to lean on our expertise and allow us to take care of you. It can be a really tedious, convoluted process to do on your own. And lastly, why us? You know, as I said, we're licensed insurance agents. We know the ins and outs of the industry, and we certainly know the landscape of this whole new healthcare reform environment better than anyone else for doing it every single day. You know, if you're going to call in directly to the marketplace, you're going to speak with a navigator. They're typically inexperienced. They do not have industry knowledge or insight, and they are not licensed agents. You're also going to get year-round assistance from your personal benefits consultant. And one of the things that we pride ourselves on here at ColoHealth is we take all of our clients through our health insurance optimization program. And it's a unique process that we take all of our clients through. Our goal here is to help our clients minimize their financial risk and that they face related to their health and to act as their long-term consultants and advisors. And really, more than anything, it's just to make this whole process of having affordable health insurance ongoing year after year hassle-free and easy for you, because we're going to be taking care of it. We're going to be building a relationship with you and getting to know your situation so that when you do have an issue with your health insurance and you need a hand dealing with the carrier, you're going to have an advocate to reach out to. So there's some, you can see here, there are lots of advantages to working with us, but to me, there's no greater advantage than to have somebody who has a vested interest in your happiness and satisfaction, and certainly to have an advocate that's going to be there for you when you need help with what gets more confusing by the day, which is the Affordable Care Act and carrying health insurance now. So to me, I think it's an easy sell. We do our very best here to make the experience of working with us, customer service at a premium, and make it easy on you. And that really is one of the best things about being associated with this company and certainly working with my clients. I absolutely love it. So let's do some recapping here. All right. So open enrollment starts November 1st. It's going to run through January 31st. The new ACA plans are much more expensive than grandfathered and grandmothered plans or non-grandfathered plans. No pre-existing conditions on the new plans or exclusions or medical underwriting, so a lot easier to get a plan issued as long as you do it within the open enrollment period. More benefits for all, including maternity coverage and prescription coverage. The doctor networks are smaller, more HMOs, fewer and fewer PPO networks, and even fewer national PPO networks. Premium assistance for those under 400% of the federal poverty level. In addition to the premium assistance, remember that if you fall at 250% or lower of the federal poverty level, you're also eligible for cost-sharing assistance, which will help you with your overall liability within your health care plan. And I wanted to reiterate one more time, I didn't mention this when we were going through the cost-sharing assistance. To take advantage of the cost-sharing assistance, you must enroll in a silver level plan. Submit your application by the 15th for an effective date of the 1st of the next month. And as I mentioned before, be proactive. Issues will arise. There are pitfalls and hurdles in this system, and the more proactive you can be on the front end, the less headache you're going to have on the back end. And lastly, let us do it for you. Reach out to your personal benefits consultant, your advisor, and schedule a time to review your situation and let them help you get the best plan in place for you for 2016. That is going to conclude our 2016 ColoHealth Healthcare Reform webinar. I'm now going to check the chat box and see if we have any questions. All right, I don't see any questions. We'll give just a few more seconds, and then we will call it a day. All right, guys, well, I wanted to thank you so much for being on this webinar with us this afternoon. And, again, please reach out to your advisor and let them help you get this out of the way. And if you need us, you see our number there on the screen, as well as our email. If you'd like some help now, simply reach out to us, and we will take great care of you. Have a wonderful evening. I see somebody the last at the bell, Don R., wanting to understand HMOs versus PPOs. All right, let's go through it. So with an HMO, it's going to be a very narrow network. Some of the drawbacks with an HMO are that you are going to have to establish a primary care physician. And if you ever need to get any specialty care, let's say you needed to go see a dermatologist, you would first have to get a referral from your primary care physician to go see that dermatologist. So you're going to pay twice. The biggest thing about an HMO plan is, short of a life-threatening emergency, you're not going to have coverage out of network. So with an HMO plan, you do not have coverage outside of your coverage area. With a PPO network, it's going to give you a lot more flexibility. With a PPO network, you are going to be able to see whatever doctor that you want. You don't have to establish a primary care physician. You don't have to get any referrals, and you have coverage in and out of network. So, you know, a few years back, all the plans that were available were all PPO plans, and most everybody is used to the flexibility of that, and it's pretty frustrating. Now most of these plans are transitioning. Most of them have already transitioned to HMO networks, which are just a little more limiting. So if you're traveling a lot, you know, you're going to be covered for the emergency. But if you have any ongoing health concerns and you need to go get checked out, if you're not just feeling right, you're going to be paying 100% of it out of pocket outside of your coverage area. So that's the big difference with the two. And when they're available now, the PPOs tend to be pretty costly. And really the biggest factor there is if there's any doctors that you currently see that you want to make sure that you're able to see on your new plan, you definitely want to start there. When I'm working with my clients, the first thing we do is establish whether they're eligible for any premium assistance. The second thing is researching the doctors that they have a relationship with, and then they're letting that filter down and seeing the plans from there, because it can vary widely, and the HMO networks are much smaller than the PPO networks. So I hope that answers your question. Anything else? Great. Well, you guys have a wonderful evening. Take care.